Three-dimensional models of liver vessels for navigation during laparotomic attenuation of intrahepatic portosystemic shunt in dogs. Welcome to Journal Club. The latest academic research, explained in plain English. Today we're looking at this paper from MDPI's Journal of Animals. It's authored by Frymas, et al., from the Warsaw University of Life Sciences in Poland, and is published open access under a CC BY license. Let's start by translating the title into more accessible language. When you read this title, you can understand it to mean in very simple terms that this paper explains how using 3D models of the vessels in a dog's liver can help guide surgeons during a specific type of surgery called laparotomic attenuation of intrahepatic portosystemic shunt. Let's expand on that a little. This research paper aims to create three-dimensional models of the blood vessels that go through the liver in dogs. The models were made so that surgeons can use them to guide their movements during surgeries to fix a type of liver problem called intrahepatic portosystemic shunt. The surgeries are done through a cut in the abdomen, called the laparotomy. Now we understand the title, which is a good start, but before we can break down the full paper, we'll need to catch up on some terminology, jargon, background information, and context. Specifically, there are some key concepts you'll need to be familiar with. Let's define them now. Laparotomy. Surgical incision into the abdominal cavity for diagnostic or therapeutic purposes. Portosystemic shunt. A passage that connects the portal vein to the systemic circulation, bypassing the liver. Parenchyma. Functional tissue of an organ, as distinguished from supporting or connective tissue. Computed tomographic angiography, a specialized form of CT scan that uses contrast to visualize blood vessels. Three-dimensional, 3D, a technique of creating digital or physical models of objects with 3 dimensions of length, width, and depth. Surgery planning, the process of identifying the optimal surgical approach and technique to achieve the desired outcome. Intraoperative, occurring during surgery or in the operating room. Low-invasive dissection, a method of tissue separation that minimizes damage to surrounding structures. Recovery rate, the proportion of patients who return to a normal state of health after treatment. Canine, relating to or belonging to the family Canidae, which includes dogs, wolves, and foxes. Now that we understand the title and key concepts, we're ready to dive in and break down this paper. In this presentation, we're going to attempt to answer 5 questions. 1. What were the researchers trying to figure out? Or more specifically, what was their hypothesis? 2. How did they conduct their experiment? That is, how did they test their hypothesis? 3. What were the results of the experiment? 4. What conclusions did the authors draw from those results? And lastly, 5. Why does this research matter? Why should you care? 1. What were the researchers trying to figure out? The researchers hypothesized that using three-dimensional, 3D, individual patient liver models, printed based on computed tomographic angiography, can improve preoperative planning and intraoperative identification of hepatic vessels during laparotomic attenuation of intrahepatic portosystemic shunts, in dogs, leading to a lower risk of complications and faster recovery rates. 2. How did they conduct their experiment? The researchers used a combination of diagnostic methods like history, clinical examination, blood analysis, ultrasound examination, and computed tomography angiography to diagnose intrahepatic portosystemic shunt, PSS, in dogs. They then created 3D models of the dog's liver vessels using digital imaging and communications in medicine, DICOM, CTA images which were pre-processed to remove noise and free triangles. These models were produced using a 3D printer and a special software dedicated to fused deposition modeling technology. The models were then used by the surgeons to perform laparotomic attenuation of the PSS in order to confirm the degree of attenuation required for the patient. They used surgical tools to isolate the pathological vessel and used a cellophane band or an aneroid constrictor to partially occlude the vessel based on visual inspection of the intestines and pancreas. 3. What were the results? The attenuation was confirmed on postoperative ultrasound or computed tomography scans. All 4 patients showed good clinical responses and were followed up for several months after the operation. 4. What conclusions did the authors draw from their results? The researchers conclude that the use of 3-dimensional models in the surgery of canine intrahepatic portosystemic shunts, where identifying the aberrant vessel is challenging, offers advantages such as simple and precise surgical planning, fast identification of the shunt during surgery, and low-invasive dissection of the liver parenchyma. They suggest that using 3D technology can potentially improve the recovery rate. 5. Why does this research matter? This paper is important because it introduces the potential use of 3D technology in surgical planning for the treatment of canine intrahepatic portosystemic shunts. This technology allows for simple and precise planning of the surgery, faster intraoperative identification of the shunt, and reduces the invasive dissection of the liver. The paper suggests that this technology can potentially raise the recovery rate of dogs with this condition, which could have significant implications for the welfare of canines worldwide. We hope you've enjoyed this Journal Club presentation of 3-dimensional models of liver vessels for navigation during laparotomic attenuation of intrahepatic portosystemic shunt in dogs. If you'd like to read the full paper yourself, which we encourage you to do, you can find it at DOI 10.3390/ARNI 131222004.